Hi, I'm Amber. I'm going to be your student nurse today. I'm just going to check that I have all my supplies and my stethoscope, my pen light, my gloves, and my hand sanitizer. Alright, so how are you feeling today?
Good.
Do you have any pain?
Nope.
Alright, at any point during the assessment, please let me know if you do have pain.
Okay.
Do you use any assistive devices like glasses, contacts, hearing aids, or canes?
Nope.
Alright. So I'm going to give you 3 words to remember and I'll ask for them later. They are brown, cheese, and cat.
Okay.
Alright. And can you tell me your name and where you are?
Teresa in Portland.
Okay. So patient is alert and oriented ×3 with clear speech. And can you go ahead and touch your fingers to your thumb? Alright. Fine motor is intact and she responds to verbal cues. Alright. So I'm going to have you close your eyes and tell me where I'm touching.
Okay. Left shoulder. Right knee. Left foot. Left hand.
Alright, good. And so I'm going to check your eyes. I'm going to check them. Good. And I'm going to check your 6 cardinal fields of gaze. Go ahead and follow my finger. Alright, I'm going to check for combinations. Just go ahead and follow my finger again. Good. And your peripherals, let me know when you can see my fingers. Good. So her eyes react appropriately, and pupils are equal, round, reactive to light, and accommodating, and her peripheral vision is intact. Her eyes don't have any redness or swelling or exudate. Corneas are transparent with no abrasions. Iris color is evenly distributed, and her conjunctiva is clear. Sclera is white, clear, and smooth. And have you had any trouble or changes with your vision recently?
No.
Good. And I'm going to check the motor function of your facial muscles. Can you go ahead and smile for me? And frown. Raise your eyebrows. And puff your cheeks. And have you had any changes in your taste?
No.
Alright, so facial muscles are equal bilaterally. Check the range of motion in your neck. Go ahead and move your head from side to side. Good. And up and down. Good. And check for TMJ. Can you open your mouth? Good. And close your mouth. So there are no signs of TMJ. And head is centered and erect. No tremors. Skull is round without deformities. And the neck and facial muscles and features are symmetrical, and she has a full range of motion in her neck. Okay, so I'm going to get my gloves out so I can palpate your scalp.
Okay.
There are no signs of infestations or lesions or masses. Alright. Good. And I'm going to go ahead and feel your maxillary and frontal sinuses. Let me know if you have any pain or pressure. Alright, and feel your thyroid. Go ahead and swallow for me. Good. So their thyroid is non-palpable. There's no masses, and she swallows appropriately. Feel for your lymph nodes. Lymph nodes are non-palpable. The trachea is benign. I'm going to feel your carotid pulses. Good. Carotid is 3+ bilaterally. And ears. Good. So ears are symmetrical, equal in size, and fully formed. There's no drainage or lesions. I'm going to go ahead and perform the whisper test, so just let me know what word I'm whispering in your ear.
Glove. Blanket.
Good. So hearing is intact. The nose is symmetrical. You go ahead and cover your nostril and breathe in. And do the other one. Good. So nares are patent bilaterally. Have you had any trouble smelling?
Nope.
Nope. And there is no drainage. Go ahead and look at your mouth. Can you go ahead and open? And stick your tongue out. Good. And smile. All right. So oral cavity is without foul odor. It is pink and moist. Tonsils have been surgically removed. There are no signs of inflammation. The uvula is midline. Tongue is symmetrical, and lips are without lesions or skin breakdown. And her teeth demonstrate good dentition. All right. So upon inspection, her chest is, she breathes easy and quiet. Go ahead and palpate. Good. You don't feel any masses or lesions. All right, so I'm going to have you turn for me. All right. So I'm going to also take the lungs, starting with the lower lobe and moving up to the upper lobe on both sides. So go ahead and take a deep breath when I place my stethoscope. All right, and can you go ahead and turn for me? Good. Lung sounds are clear in all lobes. All right. And going to go ahead and listen to your trachea and then listen to your carotids. Trachea is loud and high pitched, and carotid should have no signs of bruits. So go ahead and listen to your lung sounds now. I'm going to start with the aortic, pulmonic, heart sounds. I'm going to start with the aorta, pulmonic, and Erb's point, and then I'm going to switch to the bell and listen to your tricuspid and mitral valves.
Okay.
Good. So heart sounds are clear and there's no abnormal rate or rhythm to them. I'm going to have you go ahead and lay down. I'm going to do an abdominal assessment. Would you mind lifting your shirt for me? So skin is pink and warm and non-bloated. We'll listen to all 4 quadrants for 15 seconds. Then listen for vascular sounds. Abdominal sounds are present and active, and vascular sounds are present without any abnormalities like bruits. All right, I'm going to palpate now. Do you have any pain or tenderness? So abdomen is soft and non-distended with no abnormalities. Go ahead and sit back up. and check the range of motion in your arms and shoulders. So go ahead and push up. Good. All right. Feel. Can you go ahead and rotate your arm for me? Good. And your elbow. And your wrist. Good. And feel the other one now. Rotate. Elbow. And wrist. Good. There are no signs of crepitus. I'm going to feel your radial pulses real quick. Radial pulses are 3+ bilaterally. And check your strength. So if you go ahead and put your arms up and push up, down, good. And separate your fingers and squeeze my fingers and push against. Good. All right. So arms. She has full range of motion in her upper extremities. Strength is 5 out of 5 and symmetrical bilaterally. All right. So can I have you go ahead and stand up for me? All right. You can turn this way and then check your chest expansion. Go ahead and take a deep breath. Chest expands appropriately. And can you go and walk to the couch and back for me? Good. And face this way. And go ahead and pretend like you're diving into a swimming pool for me. All right. Good. So patient holds her head erect. Her cervical spine is straight in alignment with no indications of scoliosis, lordosis, or kyphosis. And she has a steady gait and balanced posture. She doesn't have any pain or masses to palpation. All right, so I'm going to check range of motion in your legs. You go ahead and rotate your hip for me. Good. Put your leg up and back. Good. To me. And the other side. Good. And back. Good. So there are no signs of crepitus. And have you stick your leg out. Out. Now cross your leg. Good. Have you sit back down for me and check hands resistance. So go ahead and pull back on my hands. Good. And push out. Good. And rotate your ankle. No signs of crepitus. All right. And push up. And pull down. All right. So lower extremity strength is 4 out of 4 and equal bilaterally. There is no crepitus or edema. And check your calf refill. And calf refill is under 3 seconds in both hands and feet. And check your pedal pulse. The pulse is 3+ bilaterally, and your posterior tibialis. Which is also 3+ bilaterally. And do you remember what the 3 words were I needed in the beginning?
Brown, cat, and cheese.
All right, good. Thank you.